this because I also suffered for many, many years with endometriosis. I am a nurse. I became a nurse 10 years ago as a career changer. And part of that, I'm going to speak a little bit briefly about this, and I know some of you also saw this last year, so it's nice to see your faces back and also to see some new faces. So we'll touch a little bit on a few things that you may have heard before, albeit briefly. When I became a nurse, I thought that that gave me a little bit of more recognition and strength in being able to be given a little bit more respect when I said that something was wrong with me, when everyone else said there's really nothing wrong with you, or that it had to do with my GI system, and I went through that whole battle with doctors. The psych issue thing, which, as I mentioned last year, if you talk to people who know me, they might say, okay, maybe a little bit with that. She's a little nuts, but anyway, it's when you're told that and you're told it over and over and over again, it's very difficult to not start to think, am I crazy? Is this something that I'm really not feeling? Am I conjuring this up? So this disease has been a battle for many, many, many of us. And what we're doing here with the EFA, and especially today, having all of you in this room, is to make sure that young girls and women don't suffer through what we've all suffered through, those of us who have come and said our stories. I have to relate also back to Padma because she has such a powerful story, and hers was ended in such a beautiful thing with her daughter. For those like Lisa and I also went through years of infertility, the treatments, the over my head in debt, because it's not cheap to do that, and it's not easy to do that, and most insurances do not cover IVF and adoption and all those kind of great things. Had I been diagnosed earlier, it might have given me the opportunity to have the child that I desperately wanted. So part of my being here and what we're doing with our outreach program also is to help that young women don't have to go through that or suffer like I did. And I know it was mentioned before that this is something that can affect you throughout your life, but also even after you've had treatment. Because that little bit of your life where if you wanted a child and couldn't have one, it's always going to sting and it's always going to hurt a little bit. So if we can help just one person to never have to deal with that or go through that or feel that pain, in addition to all the physical pain, all the isolation that they go through when they're young girls, this is why it's so important. And we are asking for your help, and we're so happy to see all your faces here today. And again, I want to echo Padma with saying, get out there, get the word out, tell people, and let's let these young girls know that it's not embarrassing. It's okay. This is just another part of your body, as if your arm was sick or you broke your leg. This is just another part of your body, and it's really okay for us to start talking about this and getting the word out there. So what we did was, and I'm going to jump right into this, we came up with an assessment guide. And we feel that this is really important, especially for those of you who deal with a population of younger girls, such as school nurses, those in OBGYN offices, but really all of us. And I'm sorry, I didn't turn around when they asked, how many are nurses in here in the room? Okay, great, wonderful. And it's kind of funny, you're gonna think, hopefully maybe you'll think this is funny. I'm a hospice nurse. So I told everybody last year, don't be afraid, it's okay. One of the things that I've been taught in hospice is the same thing that I think we all learn as nurses. What is our main thing? It's to care for a person. That's why hopefully I can say that's why we all got into nursing, because we care and we love what we do and we love to reach out to people and say, I'd love to help you, let me find out how I can do it. If we don't know how to help, maybe we can find out. And that's a really important piece of this. We can no longer say, you know what, that's what your period's supposed to feel like. Nah. I learned in hospice that when a person says something's wrong or says they're in pain, my ears need to perk up, my eyes need to perk up, my mind needs to find a way to meet them where they are and to help them where they are. And that's what we need to do with these young girls. Kids growing up, and I think we were probably like this when we were that age, but you know, they're smarter than we give them credit for a lot. So we have to listen to them And we can't just allow them to go off into the distance and, not be able to help them. We have to really listen. We have to meet them where they are, which is probably in a frightened, scared place. So we were hoping that this assessment guide would be kind of an in with that, to help and to understand and to be a way that we can facilitate that open discussion and also to bring up the conversation about it, have these girls be able to talk to their parent or guardian and also to their doctors about it. So any nurses who are involved with the care of young girls and young women, I believe, and the foundation believes, that we should start to assess these young women the same way we assess for any other childhood or female diseases. We have a questionnaire. You always have those long questionnaires. We talked about that before too. I filled out all the paperwork. All this paperwork that we fill out before we go in. These should be questions that we're asking. Are you having painful periods? Are you having excessive bleeding? Describing what excessive bleeding is. For a young girl in school saying, do you bleed through a pad or a tampon in one class or in 1 hour? Are you curled up in a ball? Are you missing out on your life, sports and dance and drama club and all the things that go along? Are you missing going out with your friends? This is a horrible, isolating disease. And what comes with it is a lot of things that we talked about. The GI, the GU problems, the back pain, the leg pain, the numbness, the migraines. I would stay in my room for months at a time, drop down to almost nothing, which, I was small to begin with, but you can't eat, you can't sleep, you're curled up in a ball. The doctors were happy to write tons of narcotics, but, that did nothing but steal away a lot of my younger days, my high school days. So it's important that we reach out and we really start to understand why this is so isolating for these girls, and why we should screen early on. Like I said, those questions should be asked. They should be out there. The screening should be age appropriate. Of course, depending on what age group you work with, if you're working with girls who are a little bit younger, on the younger side of like when they're first getting their period around maybe 11, 12, of course, we're not going to focus so much on infertility issues as we would maybe with college-age girls. I don't know if anybody here works with college-age people. I know Sharon does. So that's important that even though we're having somewhat of the same conversation, weaving things in and out, it's important to have age-appropriate things to speak to these girls. And the survey that I'm going to show you, the paperwork that I'm going to show you, it's important that it's non-threatening. Even though when we talk about the definitive diagnosis being surgery, of course, it's frightening. It's frightening to a woman who is older because none of us want to have to think about that or deal with it. So we can only imagine what a young girl's thinking who most likely, hopefully, has never had to have surgery in her life. So we really need to kind of gear it to say, listen, it is a surgery, it is invasive. However, it's not terrible. They're going to go through small little holes. They're going to look in there. It's important for us to make it in a dialogue they can understand. We want to keep the terms so they're more layman's terms, but we also don't want to discount these girls by, kind of dumbing it down too much. Because like I said, I think they're, a little smarter than we think sometimes. All of you have the guide in your folders, in your bags, if you can just bring that out, because I know sometimes it's a little difficult to see on the slides. And we'll just go over this briefly. The first page is the endometriosis screening tool. And as you can see, there's some directions on there as to how to use this tool, or which way would be appropriate really to use the tool. And there's 3 primary screening questions at the bottom. The screening questions, have you experienced so much pain around your periods that you're unable to attend school, work, or social events? Very important, because as one of our other speakers mentioned, we want to look at this and say it's not always about when they come into the school nurse office or what. Let's look at, wow, they've been absent quite a few times, or they're not showing up for clubs, or they're not, participating in social events. What's going on with this person? Especially, you have your girls who might be a little bit more shy. You have those who are very gregarious. If you're seeing that there's a change, and you are the people on the front lines, you're right there dealing with these girls all the time. You know your students, you know if there's changes, so that's a really good point. Have you experienced heavy bleeding that lasts for more than the first 2 days of your period? We explain that, and that can be elaborated upon saying, if the girls are saying, I can't make it through a class, without running out, then we know that's a problem. Have you experienced recurring pelvic pain, which is pain in the lower belly? Because we want to tell them that when somebody might not understand exactly what's pelvic pain. Anytime during the month where you do not have your period, which prevents you from participating in activities, causes you to take medications to relieve pain. I think this is an important point as well. We want to find out what these girls are taking, how much they're taking. A lot of what happened with myself, I know, because I would just dump anything down to try to relieve the pain. You do end up with gastrointestinal problems at that point because you're just burning holes in your stomach. So, and a lot of times because of pain, we all know when we're in pain, we don't want to eat. We don't want to do things. We just take a pill and lay down, which all of us as nurses know, not a really good thing for your belly. So these are these first 3 initial questions that should be asked. And what we're going to go to the next page. With the following page, if any of those 3 questions were answered yes, any of them, 1 or all 3, 2, it doesn't matter. You should probably go to this page and get this page filled out. Now, if you work in a doctor's office, OBGYN office, this is probably a good thing. You can go over this with the young woman in your office, even if you're a school nurse and you hand this to the girl and you say, you know what, if you answered yes to a couple of those questions, I don't want you to be scared. I'm not telling you this is what you have, but I'm going to help you by finding out. Maybe this isn't what you have, but at least we're a step forward to make you able to have a better life again. So try to make it non-threatening, but this page goes into a little bit more detail, as you can see. And if they're really filling out a lot that's in that little box on the right, we know we're looking at probably, again, something to take us a little bit deeper, a little bit more knowledge about what's going on with these girls. And if this form is sent home for the girl to fill out, sometimes that can be a better thing because they may be more honest. And you want to tell them that honesty is the best thing for this. You don't want them to hide their symptoms or lie about them. You're not going to get in trouble. It's going to be okay, and we're going to find somebody to help you. We want you to know that when you fill this out. That's probably a good way to start. They can bring it either back to their parent guardian, and then we're going to talk a little bit more further on about how to elicit help and what is a good way to elicit the help. And that's going to be our next page. So just briefly going over this, you can see the questions we have on the left-hand side. This would be for somebody who may have already had these issues and had they been diagnosed with ovarian cysts, and it brings into it about the exhaustion, the weakness. Also the genetic link, as we talked about a few times, which we're finding more and more as the research goes on, even just listening to stories. Again, as nurses, what do we do at the beginning and end of our shifts? We report, right? We love telling stories. Well, we do that. We love hearing about those patients' stories. We love hearing about what happened in their families. Well, what about this? What about that? We're finding that it's very, very important to know, did your mother suffer like this, even if they weren't diagnosed? How were your mother's periods? Did you notice her being doubled over in pain? And when we started working on this tool, it occurred to me that I remembered seeing my mother like that, and it would have probably never occurred to me had I not thought about this. Laying on the couch with the headache, the nausea, and we were kids, and she said, you guys, you got to just play right here because so mommy could see you. But sick. And talking to her later, realizing at 40 years old she had a total hysterectomy, really not knowing why, because they just said that she needed it. She probably had it as well. She probably had endometriosis, and we didn't know. So that's a very important question. So going through those, and then we're going to the next page. Now, I know this has a lot on it, but it's a very important page. This information sheet, it's very thorough and informative, but it can be administered to the patient, the parent, or guardian, and to be reviewed by both. Important considerations are discussions with regard to preparation of physician assessment and appointment, and it encourages the patient or guardian to seek appropriate and compassionate care. We do mention this later down, and I encourage all of you to read through these because they're really great, they're super important, and I think that The language on them are wonderful, and it really opens up, it'll open up your mind a little bit more as to what to say and the things to say that are really good. One of the things that I want to point out is how important it is to allow not only the young women that you're talking to, but the parents, the guardians, to understand that because this disease can be very misunderstood and misdiagnosed, underdiagnosed, if they're not getting the answer they need or want from that first doctor, they need to just keep on going. Whether it's 2, 3, 4, I had 5 doctors. I had 4 botched surgeries before I found Dr. Sechkin, and that was on my own, just at the end of my wits, going crazy, looking everywhere for help. So you have to be tenacious, because this disease is also tenacious, but what we are finding out there and the way doctors just wash their hands of it and say, you're supposed to feel like that, it's called a period, you're a girl, suck it up. Yeah, you gotta say, no, I'm not gonna suck it up anymore. I'm not gonna do it. So it's important to let the parents, the guardians, and these young girls know it's not okay to feel that way. And when your body's in pain, it's telling you that something's very wrong. It's okay. We're going to help you to find out why, but this is what you need to do. So please encourage anyone who you talk to continue to get diagnosed or to continue to get opinions until they find one that suits and somebody that can help them. And that's really one of the most important things I think about this assessment guide. Again, make sure the information is appropriate for the age group. Included with the assessment guide is a personal pain profile. And this allows the young woman or girl to make marks on these bodies. And because we know that endometrial tissue can occur anywhere in the body, even though it's primarily in the pelvic area, pain can also radiate. Pain can be felt in many different areas. So you want to encourage women about that and say, if you're feeling pain somewhere else, it may not be an endometriosis at all, but we just want to kind of know where all of your pain is. And we have the key on the side, so you can mark P over all the areas that they're having pain during their period, X over the areas which are any other time in the month, and C where they experience constant pain, which can happen. And we also encourage them to be creative with it. They can use different colors. They can use whatever suits them to help them to get that out. We included a personal profile daily symptom tracker. And this calendar is made to be used as a cyclic calendar. So it should begin on the first day of the period and not on the first day of the month. We included boxes that are typical for the symptoms. However, there is another box, but I think this is a great place to encourage young women and girls to open up a journal and get a little journal and start to correlate the days. If there's not enough space for them, or if there's something that they're not seeing on there, it can be very cathartic for them to write a journal. The other great thing about not only the assessment tool and having this in front of you, but having a journal, and I know for me, I'm a very visual person. When you see that in front of you and you start marking this up with red, it's one thing to say, oh, I have pain a lot. When you look at that physically, or the girl looks at that, or their parents or guardian, or better yet, when they take this in and say, here, somebody gave this to me and this is how I'm feeling, and I need you to know, I need you to help me. To look at that and go, wow, this is taking this person's life. This is taking a quality of life away. So that's where I believe having that piece of paper helps. And to have that visual of this is a huge chunk of this young woman's life that is being affected by something. Let's find out what it is. Also the journal, as I mentioned, great for them to get it all out. How much medication they're using, what they're feeling. I cried this day. It was so bad I stayed in bed all day. These things are really important and can be wonderful just for them to be able to have an outlet for it, as well as for us as nurses, since we're the first people, maybe we pick this up before the doctor does. And we look at it and then we say, this is wrong. So what is our job? To go to the doctor and go, hey, come on, I need you to look at this, come on. No. I'm not going to listen to yell at me. Just look at this. And I want to help you with this. So it's important for us to be a little tenacious, too, about all this. So that is our assessment guide, and it is available on the website. There's plenty. I think you each have one copy in your file there. We also have our posters, which Padma talked about, too. These are great. We hope that at some point you will go in every women's bathroom, anywhere that you go, and you will see this, because it's important for us to start making this more familiar, making it less frightening, making it less like, oh, God, we shouldn't talk about that. That's a period. That's, bad. We need to start talking about it more and more and more. I know that we are going to be talking a little bit about our outreach program coming up, and I want to mention that this is very, very important for us, so we're hoping that you will all kind of be ambassadors for us as well. I did one presentation in a school, and it's been a couple of years since I was in high school, or a couple of decades, and so I wasn't sure how it was going to be received, or because it was boys and girls. And I have to tell you, one personal experience was not only did their ears perk up and you start saying these things, you get a couple little snickers here and there, but there was a boy and a girl sitting together, and they were boyfriend, girlfriend, and after we went through the whole thing, he turned to her and he said, I am so sorry, and I'll never say anything to you again about when you have your period. I'm so sorry, I didn't know. So this is not just for us to be telling the girls about. This is for us to be telling everybody about, because Padma mentioned it, and I think a bunch of our presenters today mentioned it. This disease affects everybody that surrounds us. It affects everybody that touches our lives and all of the lives that we touch. And on that note, as nurses, that's what we do. We touch lives. We care about people. Sometimes we put our hunger aside, our thirst aside, our bathroom aside, because there's somebody in front of us that truly, truly needs our help. And it is important for us to do that, to listen, to understand a little bit more, and to be able to help. You have the opportunity to change a woman's life, to save her from years and years of pain, infertility, lost relationships, lost careers, just fun. So you have the ability to change the quality of life of a young woman, and I hope that you do that. And again, I thank you all for your kind attention, for staying for all day today. Thank you.